Ladies and gentlemen of the 7th Congressional District of Pennsylvania, this is message number 2 to you regarding your representative in Washington, D.C., Joseph Sestak. On February 13, 2009, Sestak voted yes for the final compromise American Recovery and Reinvestment Act of 2009, Obama's stimulus plan, which is really just a socialist agenda to transform this society. The final bill was over 1,100 pages and with interest will cost over $3 trillion. Sestak did not read this bill before he voted yes to mire you and your family in debt for generations. No one did. In this segment, we will focus on health care. This bill provides $19 billion for healthcare information technologies, quote, to jumpstart efforts to computerize health records, end quote. Your private medical records are being posted to a government database. This is a violation of the Fourth Amendment and violates the doctor-patient expectation of privacy. 2. This bill also includes $3.1 billion to evaluate the most effective healthcare treatments. $1.1 billion to, quote, compare the effectiveness of different medical treatments, end quote, just another term for rationing. $500 million, quote, to prepare our country for universal health care, end quote. $2 billion to increase the number of uninsured Americans who receive quality health care, end quote. What does this mean, to prepare our country for universal health care? Nationalized health care is a fundamental step to socialize a nation. Every nation that has gone down this path to nationalize health care regrets it. Why? It leads to lack of access and rationing of health care. Look at several examples. In Japan, people die trying to find a hospital that agrees to admit them for certain ailments. And the reason is they don't have enough physicians and specialists to treat people, especially in rural areas. In Japan, the average doctor visit is 7 minutes per patient. Compare that to the United States, where the average visit is 20 minutes. In Canada, if you're 65 years old and you want a hip replacement, the average wait is 6 months. Why? Each year, Canada falls 500 doctors short of the 2,500 it needs to produce to maintain its service. There is an average wait of 17.7 weeks to be admitted to a hospital for surgery in Canada. Let's take up rationing. In the United Kingdom, Alan Milburn, England's health secretary, admits that the business of the service is to ration care. Cost cutting includes setting up panels that restrict general practitioners from referring to other general practitioners' cases. In other words, no second opinions. Panels also limit pharmaceuticals, certain treatments, research and development, and new procedures. In essence, national health care evolves into a rationing system for the entire society. The elderly and the infirm are generally the most disenfranchised. Think about this. There are millions of people toiling daily to deliver our current world-class care. Is it not the height of arrogance for Sestak to vote for a plan that a few bureaucrats in Washington, D.C. will make these billions of decisions every single day? How does it feel, ladies and gentlemen? Your rep in Washington, D.C. just voted to impose on you nationalized health care. Welcome to socialism. I urge you to pass this link off to friends and family in the 7th Congressional District of Pennsylvania. Thank you.